All right, so without further ado, my name is Nicole Christensen. I am the president of Care Answered. I'm a board certified patient advocate, and I'm the author of the book From Crisis to Calm. So today I'm very excited to present Medicare, What You Need to Know Today. I know as an advocate, we're advocating generally when people are in a transition of care. So if there's a decline in health, if there's some kind of change, and sometimes that change is insurance. So I get all sorts of questions. What's the difference between Medicaid and Medicare? Aren't they the same things? They are not. Um, do I really need to think about Medicare if I am working or I'm getting my insurance from my job or previous job? Um, I'm in a rehab facility and can I change my insurance at that time? What's the difference between Medicare and Advantage plans and supplemental plans? What's this A, B, D, C? What is it all about? So when I get those questions, I often come to my colleagues and part of the Care Answered family to help people navigate specifically regarding Medicare. And two such colleagues are on the call today, I'm excited to say. So we're going to speak with them. They're going to present for us. The first will be Jane O'Malley, who is an independent senior health representative for Senior Services of North America, and Medicare is her bag. And then we have Stuart Small, group benefit and Medicare specialist. He is also an independent insurance broker specializing in employee benefits and Medicare planning. So these are trusted colleagues that are truly experts in their field, and I warmly welcome them and thank them for being here. We will start with Jane, who will tell us kind of the basics of Medicare, which is still, even on its basic level, very confusing for many.
Thank you, Nicole. Thank you for having me. And with Stuart, it's really great to be here. And oftentimes, it's so confusing for people, even if they're in the healthcare field. There are so many things that we don't understand. But what I want to do first is to just tell you a little bit about myself. I am an independent agent. As Nicole said, I am certified with all the major carriers. I do not represent one carrier. I do represent all of the major carriers in this area. I am also licensed in not only New York, but New Jersey, Pennsylvania, Connecticut, Virginia, North Carolina, South Carolina, Tennessee, Florida, and Maine. So if you do have relatives or friends that are needing assistance, I certainly can be the person that can help them with the plans that are in those particular states. Which brings me to one thing in that you do have to have a plan within the area that you are living in for the most part. So if somebody moves, then they need to find out if they need to change their plan, all of them, some of them, or none of them. So it is important to keep that in mind. So as far as basics go, we start with the A. Part A on Medicare is the hospitalization. With hospitalization, if you only had Part A and Part B, and you go to the hospital, as you see on the right-hand side of that chart, you would be responsible for $1,484 the minute you step through the door. So that would be your piece. If you were there longer than 60 days, you're going to be paying $371 every single day, so on and so forth. If you look a little bit toward the bottom, it says skilled nursing care. On a skilled nursing care, when you've been in the hospital, they send you to rehab, that's skilled nursing care. Medicare will pay the first 20 days. After that point, you are responsible for $185.50 every single day. So the point of real, and before I forget that, also hospice care. Hospice care is covered both by Medicare supplements and the Advantage plan. So Medicare helps on with hospice all the time. Um, so the point of showing you Part A is to show you the holes that we have to try to fill. If you were looking at running water and you had a leak, here's all the leaks. We have to try to stop the leaks and try to fill up, so that we have as much coverage as possible. With Part B, which is the next slide, Nicole, Part B is with your medical coverage. In other words, this is for your doctors, this is for the labs, this is for home health care if you need it, this is for outpatient hospital, this is for the blood with the labs, and any medical expenses that you have when you visit with the doctor. For those of you who may not be on Medicare yet, it's simply an 80-20, and that's something that most people understand. The company, or Medicare in this instance, will pay 80% of the cost, and you're on the hook for the 20%. So again, here we have another leak in our system where we have to try to plug it up. 20% could end up being lots of dollars. So that's why, with an 80-20, we try to make sure that you understand I can't just be with A and B because it leaves too much of an unknown expense. Also, while we're on this piece, you'll see that at the very top to the right, there is an annual deductible now for Part B. And for 2021, that's $203. What that means is your first billing that you incur during the first visits to the doctor, you are responsible for the first $203. Okay? All right, we'll go to the next page, which is really the most important page as far as I'm concerned. Here's where we need to make decisions. We've already realized that if we have Part A and B, we don't have enough coverage, or it leaves us with a lot of possible expenses. So when we look at this page, here's where we can make decisions. If we look at the left-hand side of the page, you'll see that it says Original Medicare. Original Medicare is made up of Part A and Part B, which we just went over. Then you have to add a separate section for Part D, which is your drug coverage. And then we have another card or another coverage, which is the Medicare supplement. How many of you have heard of AARP? That's what the doctors know. That's what they tell you. Go get AARP. We'll be fine. Well, that's fine, and that's a good plan, but sometimes it's going to cost you more money than you can actually afford. On Original Medicare, it's basically the Cadillac of coverage. It's giving you no network, so you can go to any doctor that accepts Medicare. You have, a separate program which you can work with your broker to decide on your Part D. And you can decide, there are a couple of, different Medicare supplements that you can look at depending on how much risk you want to take. But most of them are with little risk. But that whole thing could cost you $300 a month. And for a lot of seniors, that's too much money for them to, especially when they're on a fixed income. On the other side of the page, where you're looking at the Medicare Advantage plan, this is A, B, and D all in one unit. So this is all together. This is a plan where you may have a zero copay, a zero premium. So if you're looking at $300 as opposed to zero, okay, let's take a look at this. With the Medicare Advantage plan, you are having the option of sometimes an HMO or a PPO. What does that mean? HMO means that you must stay in network. A PPO means that you do have the option to go out of network. But if you do go out of network, it's going to cost you more money. But you're paying, two things I want you to remember, especially. On original Medicare, you pay before you receive services. So you're paying the monthly premium whether you receive services or not. It's like paying your car insurance. You pay every single month, whether you have an accident or you don't, or you use it or you don't. So it's that kind of concept. On Medicare Advantage, you pay as you receive services. So here you have a copay to see your doctor. You have a copay when you go into the hospital. You have a copay for a surgical center, so on and so forth. There are many things that are zero, but I'm just bringing up some of the things that you would have a copay for. Now, what happens when you're trying to make this decision? Well, here's when I encourage you to work with someone like myself or Stuart, because our job is to make sure that you are in the most suitable, the most comprehensive, and the most affordable plan. And how do we figure that out? We will take the names of your doctors, we'll take the names of your medication, we'll take the pharmacy that you go to, a hospital that you prefer. We'll have as much information as we can get. We will do the research, and by the way, there is no charge for what we do. We'll do that because the insurance companies compensate us. There's no charge for what we do, and we will find the plan that is going to be the most suitable, or give you the option so that you can make the decision to help get the plan that you're going to be happy with. I say, and oftentimes I will help to be the voice of your choice. So I'll do the research, I'll be the voice, you make the choice. One thing to keep in mind, and one reason why we do need this, option, we are all different. My needs are not the same as Stuart's needs or Adam's needs or Nicole's needs. That's why we do this research, so that we can come to a conclusion that's going to be the most suitable. The only other thing that I would really encourage you to think about and remember is the stuff, and we were talking about this earlier before everybody came on, what you're seeing on the TV, what you're receiving in the mail, what you're receiving with phone calls if you are a senior already. Just disregard it unless it's your carrier that's calling about a particular instance. Maybe there's some bill that they have a question about or whatever. But for the most part, all these advertisements, 90%, I would say, are geared toward Medicaid. So a lot of these extra benefits that you see are especially for those that are on Medicaid. They don't necessarily apply to the general public, but everybody sees it and everybody thinks that they can get it. Now, some of the Medicare Advantage plans do include extra things like dental, gym, vision, and hearing. Some of them, a few of them, have over-the-counter, and some of them have transportation, but not too many unless you're on Medicaid. The hearing and the dental and the gym have improved throughout the years on the Medicare Advantage plan. They are giving more. But the benefit isn't just, a carte blanche. They'll have dollars assigned that you can spend, and that's that. If you spend more, then you're going to pay. So, for example, on vision, some of them have $100 you could spend. Some of them have $300 you could spend. I don't know about the rest of you, but sometimes when I get glasses, it's like $600. So I would have to pay the rest. Dental, they do have, some of them are very minimal, $250. Some of them have nothing with comprehensive, and some of them have up to $2,000 worth of dental. So again, it depends on what the person's needs are, what they're really looking for, and it's up to me to help them find it. I think that's pretty much what I need to tell you. Maybe one other thing, we are a guaranteed issue state. So what that means is there's no medical questions asked. So if someone is moving, for example, this has happened to many several of my clients, they go to Florida. Well, they might only go to Florida for a few months, but their residence is here in New York. That's fine. If they choose to move to Florida, and they are on Medicare supplement plan, there are going to be medical questions asked. And oftentimes the price of that supplement will go up drastically. So again, here's another reason for us to look at, their needs and to figure out what's going to be the best thing, because they could even purchase the supplement plan in New York, take it with them, and still have it work in Florida. Did you want to do questions now, Nicole, or we'll always
Yes,
do it?
I have. I'm looking at the chat. I don't see any questions right now, but I do have a question that comes up very often. And I'm so glad you brought up Medicaid with this as well. People have asked me, and we know that Medicaid is a separate entity. Now everybody on the phone and on this call knows it, right? So, but is it true, or do you know? You don't need to say a specific plan, but there was definitely talk about Medicare Advantage plans potentially offering more home care, meaning home health aides in the home. Do you know anything about that, Jane or Stuart?
Yeah, on the, I think it was listed on the Part A section where it was listed as home health care. But home health care on Medicare Advantage plan right now is only by prescription. The doctor has to give a prescription, and it's only short term. It could be a week, it could be 2 weeks, maybe it could be extended. Some of the carriers are beginning to have a little bit more with home care. So it depends on the carrier. But generally, when you see home care associated with a Medicare Advantage plan, it is only short term. Does that answer your question?
Yes, it does. Yes, it does. It's always been there for Medicare, either plan, but either kinds of plans.
Right.
But it certainly sounds like they're trying to up it a little bit more, even though it's always short term. Is that
Yeah.
what I'm understanding?
Yeah, the carriers are trying. I know one in particular is trying to do a little bit more, and the government is actually talking about, a few things. Like, for example, they want to try to include some more dental, vision, hearing, etc., in the Medicare supplement plan,
Mm-hmm.
because none of that is included in supplemental plans. The gym is included, but nothing else. So I think home health care is another thing that is up for discussion with the government. I was just reading an article actually that is saying that they want to try to have more things to present to CMS and get it approved. CMS, which is the Centers for Medicare and Medicaid, they are basically having to follow what the government rules are and what they're trying to do. And so they're the ones that would implement it. So it's just, something that's in the pipeline, but not done.
Got it. Thank you. And
Mm-hmm.
Adam, you had a question.
I did, Nicole. Thank you. And thank you very much for that, Jane. And thank you in advance, Stuart. But my question, and you, at least your presentation showed something that what is chosen now or what is chosen today is not final. There are opportunities
Right.
for change.
Absolutely.
And that's great. And I understand there's open enrollment times, which is October 15th through December something.
December 7th.
December 7th.
And Stuart will talk about that, those
Right.
special times too
portion
as
of
well.
the presentation.
Oh, okay. Well, then
Yes.
either one. But my question is very specific, however. When somebody needs to make a change, maybe they're on an Advantage plan or something along those lines, and then something traumatic happens in their life and they say, oh my gosh, I'm going to have some serious surgery.
Yes.
And they plan for that. And it's not emergency surgery. It's something where they can say, I know I can do this in February or whatever, a couple of months away. So they make the
Right.
change during their change time. Is that
Right.
change immediate, meaning that I make that change and the next day I can go in and have that surgery?
No, no.
Okay.
It's always the first of a month. So if you have a drastic, change in your life and you know that you need to change your plan, it has to be on the following first of the month. Okay.
Yep. And Stuart's going to
so
go
it-
into
Yeah,
that
that's
in
gonna-
more detail
yeah,
in
I'm
just
gonna
a
kind
moment
of-
too.
Okay.
Is it-
That's okay.
That's going to be the essence of my talk, is that there's a variety of different times
Thank you,
to
Adam.
make changes, and that's a great topic. Thanks for introducing that, Adam.
It's a
Yeah, I
perfect
mean, we have all-
segue. It's a perfect
It's
segue
like,
for
Exactly,
Stuart
yeah.
to begin. So
Yeah.
thank you. Thank you, Adam. And Stuart, please
Yeah.
take it from there.
Yeah, well, thank you, Adam. That was the transition, because Jane did a great job of laying out the basics of Medicare. And what's great about having choices, you mentioned about original Medicare, maybe with a supplement, you've mentioned Medicare Advantage. Choice is good, because we like to make our own decisions, and also our life changes over time. So what might have been the right decision at one point suddenly seems like there's a better choice for you at that time. So the biggest thing that comes up is, when can I make changes? And there's actually a lot of different opportunities to make certain changes. And what I would encourage everybody is, don't assume that you can't do something, because sometimes I hear people that didn't do what they could have done because they assumed they couldn't. Their friend told them. I recommend always reaching out to someone like Jane or myself, and there's a lot of good people out there doing this. And quite honestly, there's 61 million people enrolled in Medicare, and Jane and we help a lot of people, but we can't help all 61 million. So fortunately, there's a lot of us. And I'm going to touch right away on the question that you brought up about making changes. We get a little spoiled here in New York because we have that guaranteed issue that Jane mentioned. So you technically could sign up for a Medicare supplement plan at any time if you had original Medicare. But there would be some issues of, even in New York, where they might not cover certain things for 6 months. So sometimes I get somebody contacts me and they had Medicare, original Medicare, and nothing else. And now they're going to have that surgery. So even in New York, where we have guaranteed issue, meaning we can't ask questions and say, we're going to charge you extra because you're sick, or we're going to deny you a Medicare supplement because you have conditions. They have to take you. What they can do is they can impose a waiting period, like most of them have 6 months. If anything was, you saw treatment or you were diagnosed for something in the last 6 months, they're not going to cover it for the next 6 months. And that's the extent to which they can protect themselves, the insurance companies, meaning everything's fine. Now I have to have my hip replaced. I'll sign up for a supplement, and after I'm fixed, I'll quit again. That doesn't work well. So it's a good idea, even in New York, to have either a supplement or a Medicare Advantage plan. Both are good choices. What's a little scary is having original Medicare and nothing else. The supplement does a great job filling the gaps, the way Jane pointed out, and Medicare Advantage doesn't exactly fill the gaps. It's a complete plan, but luckily, they all have a cap, a maximum out of pocket. So even if you had the worst health year of your life, there would be a limit to where the most you could spend in that year if you stayed in the network. So both are good options. So what often comes up is, if you can plan ahead, and I often have people saying, if you're going to have your hip replaced, your knee replaced, most of us don't just wake up and say, I think I'll do that tomorrow. Most people put those kinds of things off as long as possible and eventually say, I think I have to do it. So very often people will say, you know what, I'm going to do those things in January or February, and they switch perhaps back from their Medicare Advantage to original Medicare with a supplement, because the surgery may cost them $0 in that scenario. And typically there's a lot of rehab and physical therapy that goes on. And they find that with original Medicare and a supplement, you may not pay anything for that kind of treatment. So I think what my clients all report to me is, who go on Medicare Advantage plans, they're very happy with those plans until they're not happy. What we try to do is help them to make the change before they become unhappy. We let them know that if something potentially is changing in your life, talk to us, and we might be able to tell you how to make the change before it becomes a problem, like planning the time. So in addition to this time of the year, when you can change, October 15th through December 7th, you can switch. Good seeing you, Adam. You can switch during this period between Medicare Advantage and original Medicare, either direction. So that's a great time of year. But there's also sometimes some special enrollment periods that allow people to do things off cycle. So when people call me up in April and they say, I really want to get out of my Medicare Advantage plan for some reason, and I want to go back to original Medicare, first thing I would say to them is, you might have to wait till January 1. We may have to talk in the fall. But in New York, we have a program called EPIC, EPIC. It's a pharmaceutical assistance program, helps people with certain incomes, and the income is not that low. If you qualify for that and you have EPIC, you actually get one special enrollment period per year to use any time to make that kind of change. So I've had people that said, I need to go to Sloan Kettering, and they told me the plan I'm on is not suitable. I ask them, do you have EPIC? A lot of times they say, what is EPIC? And if they get enrolled, usually it takes a few days, they get EPIC. First of the month, as Jane said, they can switch back to original Medicare. So I would think that the important thing is to not assume you can't do certain things. You should ask, is there a way? So that's a special enrollment period. And when you move to another state, if your plan is getting terminated, a variety of circumstances can give you special enrollment periods. I think Nicole touched on it. I just had one recently where someone called me regarding her father, who was in a skilled nursing facility, rehab. And the facility said, he was on a Medicare Advantage plan, and the facility said, it's time, the insurance program told him it's time to go home. The facility wanted him to stay longer, and so did his daughters. Well, guess what? Being in a skilled nursing facility or being released for one actually is a special enrollment period. They called me 2 days before the end of the month. On the first of the month, I was able to put him back on original Medicare with a supplement, and he got full coverage again as of the first of the month that he needed. So that's kind of important. We do get spoiled in New York because we can switch back to a supplement whenever we wish, no questions asked. If we're on original Medicare, so we switch back. In other states, it's not so easy to do so. So that's kind of unique to us here. I think that some of the biggest challenges I see is when people mess up about enrollment periods. They don't do things during their initial enrollment period, which is when you turn 65. You have 7 months, the month you turn 65 and the 3 months before and after, to enroll in Medicare. And if you miss that opportunity, you may have to wait till the general enrollment period to enroll, and it can be a problem. So I encourage people, be aware of when you're turning 65 a few months before. Speak to someone like us and see, what should I do? And the answer might not be what your neighbor did, because if you're working at a larger company that has good benefits, you may actually be able to wait to sign up for Medicare until you decide to no longer be on your company plan, you retire, work part-time, whatever. But another pitfall, when you do leave your employment, when you retire or you become no longer eligible for benefits, you have 8 months to add your Medicare Part B, the medical coverage. You have 8 months. You can add Part B Medicare either while you're still an employee or within 8 months after you leave employment. I just had someone unfortunately call me about 2 weeks ago because somehow she was misinformed by someone who I think at her employer. She went on COBRA, like people are used to doing when they leave a job. You have 18 months of COBRA. Guess what? COBRA is not a qualifying program for this purpose. So as she's in the COBRA program, more than 8 months went by. She was healthy. She didn't go to any doctors. She got very sick. She found out since she did not have Part B, even though she was on COBRA, her bills are not paid and she has tremendous debt now. She wants to add the Medicare Part B now, but they said because it's after the 8 months, she has to wait till the general enrollment period, which is January, February, March of next year, and her coverage will go into effect on July 1st. So here we are in October, running up tremendous debt. Don't want to say how much it is. I felt terrible. And she will not be able to have Medicare coverage till next July. So I gave her some recommendations of government organizations that might be able to help her, but I wasn't optimistic. So unless she has very, very low income, there may be some exceptions. But in her case, I don't think that's what's going to happen. So I try to point out, you have to be really careful about these enrollment periods to make sure you don't miss it. Some people also don't realize when they go into a Medicare Advantage plan, and let's say it comes January, and you realize, I picked the wrong plan. My doctors don't actually participate in this network. You have the opportunity in that first quarter, January, February, and March, to switch to a different Medicare Advantage plan, or even to switch back to original Medicare with a supplement. And whenever you make that decision, it will go into effect on the first of the month after you make that change. So I do get a lot of calls in the first part of the year where people missed their open enrollment, October 15th through December 7th. They didn't make a change. They can do it in that first quarter, or they made a change to Medicare Advantage and realized it wasn't the best decision for them. So what I think is great is that you have a lot of opportunities to make changes. And you just need to reach out to someone like Jane or myself and ask, here's my situation, what can I do about it? And try to protect yourself in that regard. That's pretty much everything I wanted to cover, and I hope we have time for some questions.
Absolutely. Thank you. Kathy has a question right away.
Hi, Kathy.
Hi, I'm just curious, with the client who called you with those bills that are mounting, would she have been able to register for Medicare Part B prior to going on COBRA?
This is a big, a big mistake people make.
Okay.
Either while she was still employed or in the 8 months after she left employment, she had the right to add Part B Medicare. But if you wait longer, then you run into this problem. Now, occasionally, I have somebody, you'd say, well, why would somebody add Part B Medicare, let's say the day they retire? Why would they go on COBRA now? Because Medicare is paying all their bills and their COBRA is just really paying the other 20%. A supplement would be much more affordable. The only justification is, first of all, they have the right to do that if they wanted to, but generally people don't do it unless they really like the prescription coverage they have through their employer plan, because their prescription coverage is still in place. And there are some drugs that are covered better on the commercial plans than they are on any Medicare plan. So some people do, if they could afford it, if they find out that drug they've been getting for $0 a month that really costs $5,000 a month will continue being covered under their employer plan, but not under Medicare. They want to stall, they want to delay the inevitable, which is that COBRA will run out. So yes, you can keep COBRA, but if your employer has less than 20 employees, you must add Part B, even if you're active. If your employer has more than 20, you could delay Part B, but do add it as soon, either right before you leave employment or as soon as possible afterwards.
Because if I understood correctly, after the 8 months in regard to this situation of Cobra, then it's too late.
Well, you have only 8 months to add Part B.
Right.
When you're no longer active employee or covered under your spouse's active coverage. So Cobra doesn't give you any rights at all when it comes to adding Medicare. It's the 8-month window that does. But even during that window, you have to have added Part B right away because your Cobra is secondary coverage, which means it's paying the 20% after Medicare pays the 80. Well, guess what? If you don't have Part B, Medicare is not going to pay the 80. So they're going to sit there and say, we'll pay the 20 after, but there is no after. So you're still in trouble without the Part B. So I encourage people, in a perfect world, I get people calling me and saying, I'm 65, but I want to work for, I don't know how long. Maybe it'll be a year. Maybe it'll be a little less or more. I say, ideally, you're going to reach out to me about 3 months before you leave employment. So really keep that in mind when you're leaving employment. Let's get the process started to add the Part B. So it's in play. The perfect scenario would be my employer coverage ended on one day and the next day my Part B kicked in, if you could actually time it that way.
Okay. That's great. Great question. Thank you. I don't see any other questions in the chat.
I just want to
anyone
add
speak
one
up?
other little twist
Sure.
to that.
Yes.
And this happened a couple of years ago, and this is kind of what we're telling our clients that are with companies under 100 employees, sorry, that it is important to get Part B as a boy, while they're working, only because there is a company on Long Island that many employers use that will not pay the extra coverage if you're not with Part B.
So
I've
you
had a
mean,
couple of clients. So if you're with a company under 100 employees, you're still working, you are 65, it's in your best interest to do A and B.
Yeah, can I add even another thing to that?
sure.
Every time we say one thing, it leads to, because there's so many little
There's so much stuff.
details.
Yes.
So yeah, and I often tell people everything that we know, Jane and I know, you could probably, if you knew how to Google the questions right, you could find everything. But you really
That's
have
a
to
lot
go
of
to
if you knew how to.
you have to go to reliable sources, typically things that end with .gov and so on. But there's too much information out there. It's the ability to sort of filter it down. So Jane was talking about a company requiring you to have the A and the B. You always want to, as you approach age 65, if you're going to be actively employed, talk to your HR department several months before and say, is there anything I should know? Is there anything I should do? And I'm going to give you an example that I mentioned. A lot of people are on HSA compliant plans while they're actively working, health savings accounts. They're usually high deductible medical plans where you get to set aside money into a savings account on a pre-tax basis. Very well received, and many larger companies are doing them. In fact, some large companies will actually put money in the savings account for you as a benefit. So here's the thing. A couple of things about HSAs is, if I'm going to keep working past age 65, I could stay on my company plan and be treated like everybody else if I do not sign up for Part A or B. Now, some people sign up for Part A, hospital coverage, because it's free. They say, I'll wait to add Part B till I retire. But as soon as you sign up for any portion of Medicare, even just Part A, you're no longer allowed to make an HSA contribution. So you have to be aware you shouldn't sign up for A or B if you want to take advantage of the HSA. So I just had someone, a medical director at United Healthcare. All his friends said, what he should do, take A, it's free. He's on an HSA, and United Healthcare is very generous to him. They actually pay the entire premium for him and his spouse, and they put a lot of money in the savings account. He didn't believe me at first. I said, here's your list of questions. And the HR department said, you're right. And the other hitch is when you do finally sign up for Medicare, they're going to retroactively enroll you in Part A 6 months earlier. So ideally, stop putting money into your savings account 6 months before you do it. So in his case, I suggested to him that that maybe he switches to a non-HSA compliant plan at some point if he's going to have a mid-year type situation.
Right.
But this was a big difference for him because it would have cost him a lot of money and problems if he didn't know that.
Right. Right. That was a good one.
Mhm.
York has a question. Do you want to just speak it out?
Yes, thank you.
Absolutely.
Unfortunately, when I was 65, turned 65, I was overseas working for the government. And I did not take on Medicare Part B. I have Medicare Part A. I have the Blue Cross Federal Employee Program, and I have the Blue Cross Vision. I have the Blue Cross Dental. Am I missing something without Medicare Part B and the Advantage and all that stuff? It's a very complex subject.
Do you want to take it or should I, Jane?
I think that question might be a little hard to answer in
It
this group
depends
setting
on
because
what-
it's so specific.
Yeah, and it depends if he's receiving anything from the VA or from the government. Are you receiving anything, any services from them?
In what respect? I'm a retired federal employee.
Okay. Do you have prescription coverage?
It has to be within the Blue Cross Blue Shield scenario.
Okay. So you are covered.
I suppose, yes. Yes.
York,
Like I say, I'm not an expert with this.
yeah, York, may I ask you, since you've been back, have you had any kind of services like a surgery, a scan, any expensive medical services?
I just had a knee surgery, which was big.
And when you had this knee surgery, it was in the hospital?
I was in the hospital, and also I had rehab.
And what happened with those bills? Did it get covered by Medicare at all?
Yes, Medicare Part A. That's all
Yes.
I have.
But but all the medical services, not hospital, were you fully responsible for all of those bills?
Yes, it was like a yes and no. It was very complicated. It was just
What
very
I would suggest is you reach out to the federal employees benefits people and ask them the question. And
Right.
I think what they're going to say, did you come back very recently or you've been back a while?
I've been back a while, quite a while.
So call up your federal, I always tell people if you have employee benefits people, always check with them. But what I suspect, what you're going to ask is, should I have signed up for Part B? They're going to say, yes, you should. You're going to ask, when and how do I sign up? And I think in your case, you're going to be one of those general enrollment period people in that next year, after January 1st, the first quarter, you're going to sign up for Part B, and it's going to go into effect on July 1st. And I would recommend you do that. But call your benefits people and confirm what I just said.
I see. Thank you. Thank you very much.
Thank you
Well,
for
one
your
other thing, are
question.
you disabled in any way? Because sometimes there's different levels.
No, not yet.
No, but I mean from service.
From service?
Are you a veteran or am I misunderstanding?
No,
No,
He's not a veteran.
Oh, okay. I'm
Not a
sorry.
I'm a veteran. I served in the military, but I retired from the
From a government job.
government. Right.
yeah,
Okay.
yes. So good luck, York.
Thank you. Thank you. Thank you.
And I will say for everyone, as Stuart and Jane mentioned, and Medicare specialists in general, They are great people to talk to and to learn and to ask those questions. Again, they don't charge. And the ones that I work with are certainly not going to say, like Stuart or Jane would never say, change to this other plan. They're going to look at what is best for you based on everything that they talked about, your prescriptions, your doctors, your kind of health right now, the hospitals that you prefer. So they can help you make those best choices. But as an advocate as well, when people have different insurance plans that are not Medicare, it's generally, and I think you'll agree with this, but please let me know if you don't, Jane and Stuart, the best thing to go first is to talk to your actual plan to see what you have, and then see what's not being covered, because nobody likes surprises. And that is the great thing about Medicare specialists. They can really walk you through it based on the information that you are giving them, so that you can access your best care. And that's what we're all about at Care Answered. So we so appreciate the work you do.
Yeah, we agree with you. It's
Great.
so important to gather all your information. It's and that's how we can best help people. We ask people what coverage do you currently have, and sometimes they act like they don't know. They think I know. I say, I met you 30 seconds ago. I don't know that.
Right.
So
But it's
the more they tell
confusing.
us,
It's very confusing for people that and their loved ones
Yeah.
when they're trying to care for them. It's
absolutely.
very confusing. Something that you thought was cut and dry, you dig down, and Epic is like a magic pill, as far as I'm concerned, with my clients, about being able to change when they thought they were getting something that was different than they were actually getting.
And I think a lot of times
so
they don't know what questions to ask. So what we sometimes do is give them 3 or 4 important questions to go back to those HR people with, and now they have all the right information lined up.
Right. That's very, very true. A lot of people, we don't know what we don't know. So having that information and advice and navigation is really vitally important. Are there any other questions? Oh, I'm sorry, Jane.
I'd just like to say anybody that is in a position where they are going to have access to their HR people, it's very important to check with them first, because some companies won't allow you to stay on once you turn 65. Some companies will. Some companies, they all have their own set of rules. So you kind of have to know what rules you're dealing with before you can move into Medicare and expect that everything's going to be done, easily. So you have to have those questions answered first, as Stuart said.
You're muted.
Sorry. Any other questions? All right. Well, thank you again, Jane and Stuart, for being here. Thank you for all those
having
who
us.
came. Absolutely. It was very informative. Take care. Thank you, everybody. Have a great week and happy fall.
Yeah. Thank you, Nicole.
Take care. Bye-bye.
Take care, Stuart.
Nice work.